Greetings, we're from SGD B4 and this is our student project presentation about Vitiligo Segmental. This is our group of members, and without further ado, let's get into the first chapter.
Hello everyone, my name is Sashikirana with Charel student number 087, and now I would like to explain about the background of our student project. So, vitiligo is a condition that causes skin to lose color. It is an autoimmune disease characterized by macular depigmentation due to damage to melanocytes, which cause areas of the body to discolor to white patches. Compared to the non-segmental vitiligo, segmental vitiligo appears with a unilateral distribution. The most commonly affected areas are the face, followed by the trunk and extremities. The prevalence of segmental vitiligo covers 5 until 16% of all vitiligo cases, and 41.3% occurs in patients before the age of 10 years. This condition has a relatively equal gender distribution. However, there is a slight female predominance according to certain studies. Although the incidence is quite low, like other skin disorders, vitiligo patients often experience discrimination in society, which has a psychological impact. So this student project is compiled with the aim of delving deeper into the explanation of segmental vitiligo. Its purpose is to contribute to the enhancement of knowledge about segmental vitiligo. Additionally, this work is anticipated to broaden awareness, particularly among healthcare professionals and the general public regarding segmental vitiligo. I think that's all from me. Thank you.
Hello, my name is Jacinda Isadora Mannuela Simanjuntak with last 3 digits of my student number 147. So in this paper, based on the background information above, the problem formulation that we will discuss in this paper are about what is the definition, the epidemiology, the etiology and risk factors, the pathophysiology, the clinical manifestation, the diagnostic techniques, the differential diagnosis, also the treatment approaches for segmental vitiligo. The objective of this paper is to learn more and further about segmental vitiligo, and the specific objective that could be formulated to answer the problem formulation as follows: to know about the definition, epidemiology, etiology and risk factors, pathophysiology, clinical manifestation, diagnostic techniques, differential diagnosis, and treatment approaches for segmental vitiligo. This paper benefits the authors and the readers by enhancing knowledge about segmental vitiligo and providing a deeper understanding about its epidemiology, pathophysiology, clinical manifestations, diagnostic techniques, and treatment approaches.
Greetings, my name is Aryanda Maitri Anjasrini with the 3 last digit of student ID number 188, and here I'll be explaining about the definitions of segmental vitiligo. Segmental vitiligo is a subtype of vitiligo, an autoimmune skin disorder marked by localized depigmentations caused by the loss of melanocytes, the cells that are responsible for skin pigment production. Unlike generalized vitiligo, which affect both sides of the body symmetrically, segmental vitiligo usually appears unilaterally, with well-defined white patches that do not cross the midline. The main symptoms of segmental vitiligo is the appearance of chalk white patches on the skin, which can also affect the hair, resulting in leukotrichia or white hair in the affected areas. While the skin lesions are usually asymptomatic, they are more prone to sunburn. The exact cause of segmental vitiligo is remain unknown, but it is thought to be an autoimmune response targeting the melanocytes. That's all from me. Thank you.
I will continue the presentations, but before that, my name is Ayu Prewerti Nia Surya with last digit student number 230. Now I will explain about the epidemiology of vitiligo segmental. Based on the types, non-segmental vitiligo is most common, while segmental vitiligo is less common, affecting 5% until 16% of cases. And based on the onset of age, vitiligo segmental has bimodal onset pattern. That means there are 2 distinct age peaks at which the condition is likely to begin. In this case of segmental vitiligo, one peak is in early childhood around 7.3 years, and another occurs in adulthood around 40.5 years. Based on the prevalence of US, there are 0.61% self-reported segmental vitiligo, where 0.28% diagnosed and 0.33% is undiagnosed. Based on Sangla Center Hospital study from 2013 until 2015, 31 vitiligo patients were identified, where 58.1% were men and 27.3% were over 41 years old. Lesion lasted 1 until 5 years in 48.4% of cases, had lesions in 42.4% of patients, and segmental vitiligo in 38.7% of patients. For the conclusions, vitiligo is more common in men over 40 and typically presenting with head lesions lasting 1 until 5 years. And from Sangla Central Hospital study, there are segmental vitiligo that reported in 38.7% of patients. That's all from me. Thank you.
Thank you so much for the opportunity. First of all, let me introduce myself. My name is Rahel with the 3 last digit of my student ID 030. So in this video, I'm going to explain about the etiology and also the risk factors of segmental vitiligo. So at first, I'm going to explain about about the etiology. So there are 3 aspects. The first one is genetic and neurogenic factors, which individuals with a family history of vitiligo or other autoimmune disorder have a higher risk of developing the segmental vitiligo. And moreover, the segmental vitiligo is also linked to the nervous system, where nerve endings release chemicals that could harm the melanocytes. The second part is autoimmunity and also the immune response. So compared to the other types of non-segmental vitiligo, segmental vitiligo has a less correlations with autoimmunity. But the segmental vitiligo still has a distinct autoimmune basis, with the immune cells like CD8 T cells targeting melanocytes in specific areas. And more than that, the studies have also identified there are correlations with localized autoimmune disorder such as a halonervi and morphea, which they can produce a unique immune response in segmental vitiligo compared to the other types of vitiligo. And this autoimmune component has been linked to somatic mutations and melanocytes, which then can create an immune target and lead to localized depigmentation. And the third aspect is inflammation and also metabolic process, which the inflammatory substance and immune cells could, such as dendritic and also NK cells, have been demonstrated and could cause melanocyte destructions. And for the metabolic parts, so metabolic abnormalities in vitiligo patients reveal a larger physiological environment that could influence the disease progressions. And more than these 3 aspects of the etiology, there are also aspects that could contribute to the exacerbations of segmental vitiligo, or we can say it's like risk factors such as stress, sunburn, or the other skin damage, and also chemical exposure. I think that's all for me. Thank you.
Hello, my name is Putu with the last 3 digits in number 138. In this occasion, I would like to present the pathophysiology of segmental vitiligo. There are several key mechanisms involved in the pathogenesis of segmental vitiligo. First, the neurogenic mechanism suggests that abnormalities in sympathetic nerve function may be present in SV. Although SV lesions are often thought to follow a dermatomal pattern, recent findings indicate that this is not always the case, leading us to question this hypothesis. Second, the genetic mosaicism hypothesis proposes that segmental vitiligo arises from somatic mutations in melanocytes. These mutations can trigger localized immune reactions, which may explain why lesions are more common on the frontal part of the body. Mutated melanoblasts tend to migrate toward the frontal midline, influencing the distributions of lesions. Next, the cytotoxic immune response plays a significant role in the condition. The infiltration of CD8 plus T cells around the melanocytes is the defining feature of the immune response in segmental vitiligo. This infiltration leads to the destruction of melanocytes, resulting in the characterized depigmented patches we observe. Finally, we must consider the role of oxidative stress in the pathogenesis of segmental vitiligo. Increased oxidative stress can lead to melanocyte dysfunction and apoptosis, which exacerbates the immune-mediated destruction of melanocytes. The oxidative environment generates reactive oxygen species, contributing to further cellular damage. That's all from me. Thank you for your attention.
Hello, my name is Bernard with the last 3 digit of my student number is 103, and right now I will talk about the clinical manifestation of segmental's vitiligo. Segmental vitiligo is a unique subtype of vitiligo, distinct clinical symptoms differentiated from other types. By understanding this differentiation, segmental vitiligo is a unique subtype of vitiligo, distinct clinical symptoms differentiated from other types. By understanding this differentiation, aids an accurate diagnosis and targeted therapy. Now we talk about the characteristic. First, the onset and distribution. It has an early onset, typically before age of 20. It has a unilateral distribution along dermatomes and does not cross the body's midline. The second is the lesion appearance. It has a well-defined depigmented patches, often accompanied by leukotrichia or white hair in affected areas. On the progression, it has a rapid initial progression, stabilizes over time, is likely to spread. On the associated features, first, it has lower incidence of autoimmune disorder. Second, common presence of poliosis or hair lightening. On the demographic, first, it has more common in younger individuals. Second, balanced gender distribution, slight female predominance. On the psychosocial impact, first, the visible lesion can lower self-esteem. Second, psychological suffering and decreased quality of life. That's all for me about the clinical manifestation of segmental vitiligo. Thank you.
Okay, thank you for your time. But firstly, allow me to introduce myself. My name is Wulan Ekaputra Tanuwidjaja with my last 3 digits of my student number being 084. I'll be briefly explaining about the diagnosis of segmental vitiligo. So the criteria for the diagnosis includes 2 things. Firstly, it's the high sensitivity, roughly 91.8%, and 100% specificity in distinguishing segmental vitiligo and non-segmental vitiligo. Secondly, is the importance of early and accurate diagnosis due to the different prognosis and treatment approaches between the both segmental and non-segmental vitiligo. And for the diagnosis process, it includes several tests, which includes a medical history exam, the physical examination, wood lamp examination, skin biopsy if it's actually needed, and blood tests. That concludes my explanation. I'll let my friend here continue. Thank you.
Hello, my name is Patricia Clarine Simpson with the last 3 digit number 125. Hello, my name is Patricia Clarine Simpson with the last 3 digit number 125. Right now I'm going to discuss about the differential diagnosis of segmental vitiligo. First of all, we have generalized vitiligo or NSV, non-segmental vitiligo. The clinical manifestation is the same as segmental vitiligo, which is chalk white patches on the skin, but generalized vitiligo affects the body on both sides symmetrically. It is also much more common than SV, and it starts off on the hands, feet, or eyes and progresses to other parts of the body. The second one is trichrome vitiligo, which is unique because it affects 3 different sections of the skin. The first one is the unaffected skin, followed by the intermediate zone of hyperpigmentation, and lastly, the depigmented area. The third one is nevus depigmentosus, which is a congenital disorder resulting in the appearance of non-progressive hypopigmented macules or patches that is stable throughout life. Next one is pityriasis alba, which is a benign skin condition that often appears as a minor manifestation of atopic dermatitis. It is quite prevalent in children and adolescents and mostly related to a history of atopy and characterized by ill-defined macules and patches with pale color, usually with mild scaling and sometimes pruritus. Thank you for listening to me. I'll pass it on to my next friend. Thank you.
Good afternoon, my name is Wulan Triyanti with Trilas ticket number 86 and I will deliver 2.8 treatment. Treatment for vitiligo isn't always necessary, but for those concerned with its appearance, dermatologists provide customized treatment plans aimed at restoring pigmentation, halting the spread of depigmentation areas and preventing new patches. Current treatments may restore pigmentations temporarily, though they require maintenance over time. Dermatologists use various topical medications such as corticosteroid, tacrolimus, and ruxolitinib to promote repigmentation, especially on specific areas like the face and neck. Light therapy and combined approaches with topical treatments are also effective but require multiple sessions. For rapidly spreading vitiligo, oral corticosteroid may slow the formation of new patches, while surgical methods like skin grafts or cell transplants are options if other treatments fail. Camouflage cosmetics and dietary changes might help, and depigmentation can be a permanent solution, though it requires careful considerations. Children with vitiligo receive similar treatments to adults, but maintenance therapy is often needed to sustain pigmentations. Segmental vitiligo may respond well to immunosuppressants, light therapy, and cell transplants. Emotional support is essential for all vitiligo patients due to potential impact on mental health. Thank you.
Thank you for the opportunity. First of all, my name is Putri Balkis Hansa Alkhanza with the last three digit numbers 136. Right now, I'm going to explain about the conclusion of segmental vitiligo. Segmental vitiligo is a specific subtype of vitiligo characterized by localized asymmetric depigmentation that typically appears unilaterally in well-defined white patches. The primary symptom is the presence of chalk white patches on the skin, which may also affect hair color, leading to leukotrichia. The pathophysiology involves complex interactions between genetic factors, autoimmunity, inflammation, and oxidative stress, with immune cells targeting melanocytes contributing to the depigmentation process. Accurate diagnosis through clinical evaluations and supportive tools is crucial for effective management. The diagnosis of segmental vitiligo requires careful considerations of its unique features, such as early onset and unilateral distribution. Treatment strategies focus on restoring pigmentations, halting the progression of patches, and preventing new lesions, often tailored by dermatologists to meet individual patient needs. Additionally, addressing the psychosocial impacts of visible lesions is vital for improving the quality of life for affected individuals. Recognizing segmental vitiligo's distinct characteristics allows for timely intervention and better management outcomes. Thank you for the attention.
And that's all from us. Thank you for the attention.